Well, welcome. This is a continuation of our current series on interviews with new faculty, and we're really fortunate to have Stefano Schena here with us today. So welcome to the Medical College of Wisconsin, Department of Surgery, and we're thrilled that you're checking out this neat little video on Dr. Schena. So Stefano, maybe we can start with why did you go into medicine, and tell us the story there.
Good morning, and most of all, thanks for having me here. I'm very excited to start at Medical College of Wisconsin with a division of cardiac surgery. My approach to medicine, I would say, is probably DNA-based. My dad is a physician, and I grew up in an environment where healthcare is deeply fostered. My dad is also an academic physician, and ever since I was a little child, he's instilled this very analytic mentality both in me and my sister. And I grew up exposed to other physicians, or frequently spending time at the hospital in his office waiting for him to be done.
So what kind of a doctor was he?
My dad is now a retired nephrologist, but
Oh, wow.
he has been specialized in academic research for kidney transplantation and the care of patients with the IgA nephropathy for 40 years.
And where did you grow up?
I grew up in Bari, southern Italy. It's the second largest city in the southern Italy on the east coast.
Yeah.
And that's one of the largest medical schools in the nation.
And is your sister in medicine too?
No, she took a different route despite the exposure.
So she stood up to the old man and said, "No, I'm not going into medicine then."
She took another aspect of Italian life and dedicated herself to fashion.
Yeah. Wow. And when did you come to the United States?
I came to the United States in 1998. Originally, my plan was to dedicate 2 years of my residency training from Italy to the lab and spend time in research, and then 2 years became 24 years in the States.
Wow. And then talk a little bit about your residency, your decision to go into cardiothoracic surgery.
So my decision to go into cardiothoracic surgery was very unusual. Initially, I probably would have followed my dad's path to go internal medicine, but then as a medical student, as I was rotating on the surgical services, I fell in love with this very unexpected rotational cardiac surgery, and I met one of my initial mentors in Italy, and I was enamored with his skills, and he became one of my role models. And from that moment on, I followed that path, both from a clinical and academic standpoint.
Oh, wow. And we all know that you came here from Johns Hopkins, but how did you, where did you do your CT? Tell us about your CT training, and then the trip to Hopkins, and then how were we lucky enough to get you here in Milwaukee?
Well, my trip was very complex in the sense that I did my first cardiac surgery residency in Italy. And then when I came in the U.S. to do research, I wanted to be a U.S. physician and train all over again. So I ended up matching for general surgery in Chicago, University of Illinois, and then I was fortunate enough to match for cardiothoracic surgery at Washington University in St. Louis, where I was exposed to some of the greatest surgeons. Eventually, all of them became STS presidents or ATS presidents. I had no idea at the beginning of how fortunate I was. That molded my decisions from a professional and academic standpoint later on. I was at Johns Hopkins for the last almost 5 years. Absolutely great experience. But my family has strong ties in the Midwest. My wife has a large family in the St. Louis area, and she strongly wanted to come back in the Midwest. And Medical College of Wisconsin was a huge opportunity. Some of my former mentors at Washington University were trained here in surgery, actually, and I heard great things. Some of my colleagues are well known in the field, and I consider myself very lucky to be here.
Oh, that's
thank
great.
you very much for.
Oh, we're thrilled you're here, Stefano. That's a great description of things. Tell us, lastly, in our last couple minutes, about your family.
So I got married late, so I have obviously a wife and two little kids.
Well, you look no more than 30 years old, so you're fine. Yeah.
I wish. But I have two little kids. One is 3 and one is almost 6. So getting close to start kindergarten in September. They're super active. They keep us on our toes more than usual.
Yeah.
But luckily, the sleepless nights are over, except for work, and they're poised to grow fast. I don't know if they will follow my path like I did with my dad, but I would hope so.
Yeah. My last question. So the passion for cardiac surgery. I mean, for those watching this video who have been in the operating room, in the cardiac surgery operating room, it's just fascinating to see the human heart exposed and everything. What would you, if we fast forward to 10 or 15 years from now, what would you like your contribution to be to the field of cardiac surgery?
Yeah, I've always been passionate about innovation, new technologies. My hope is, first of all, to continue to learn and stay up to par with the rapid changes in our specialty, but mostly I hope to be able to bring up something different with the help of my partners and colleagues and stay up to speed. So mostly would like to help with the development of the transcatheter therapy program with the help of our cardiologists and colleagues. But I hope also having excellent colleagues here experienced with robotic surgery to be able to bring some of the robotic cardiac surgery as well.
Yeah, so it's such a rapidly evolving field. It's really incredible. The whole spectrum from surgery for atrial fibrillation and other ectopies to heart transplantation, mechanical circulatory support. I mean, it's just incredible. The field is just moving so fast, as is the case with many areas in medicine. It's almost like we have a rebirth of excitement. But Stefano Schena, thank you so much. Really great to have you here at MCW, and thanks for spending a couple minutes with myself and with Haley. Thanks, Haley.
Thank you very much, Dr. Evans. Thank you, Haley.